Hello, everyone. Welcome to this webinar. Thank you for taking the time to listen here. I'm Dr. John Arns, and we're going to be talking all about cholesterol. This is called Cholesterol, the Good, the Bad, and the Ugly. Obviously, most people in our society view cholesterol as a villain, as a dangerous compound that wreaks havoc on our heart, causes heart disease. In my opinion, and we're going to go all into this, that is not factual. Cholesterol is not the villain. We're going to go all into that here, and hopefully everyone learns some valuable information. Kind of clear the air and the misinformation regarding cholesterol. So let's dig in. This is Dr. David Perlmutter. He's wrote a few different books, nutritionist, talks about nutrition a lot, but this is a quote from him. He says, "We need to change our attitudes about cholesterol and even LDL. They're our friends, not our foes." I'm going to go into all the research that validates this opinion. Obviously, he's written a lot about this subject. And just show you that we've had this wrong for years, this hypothesis, this idea that saturated fats and cholesterol specifically cause heart disease. There's just not a lot of good evidence that shows that. And there's a lot of good evidence that shows cholesterol is an extremely important compound for the human body and for a lot of different things to help our bodies function optimally. Another quote from him: "Two forms of fat that are vitally important for brain health are cholesterol and saturated fat." Cholesterol is literally an essential, vital nutrient and component for optimal function of our brain and our heart. And they're telling us to what? To constantly lower it, to get it down. And it's having a negative effect on health outcomes. And we'll talk more about that here in a little bit as well. So get into the good, the bad, the ugly. The good with cholesterol. So as I just stated, cholesterol is an essential component of all body cells. We literally would not exist without it. Our brain and our heart cannot function without it. And cholesterol, so this is the big idea here, cholesterol itself is not inherently bad. In fact, I would say it's quite the opposite. It's a large component of the actual structure and tissue of our cells, especially our brain. And it's really important for everyone, but especially infants, where brain development is so rapid. There's a lot of brain growth. Without proper amounts of cholesterol, you're just going to impair the optimal development of the human brain and the healing of the human body. So the bad with cholesterol. So cholesterol itself is not bad. It's the oxidation of cholesterol from underlying inflammatory factors that leads to disease and dysfunction in the body. So we look at all the different inflammatory influences on the human body, really from the day you're born, really from the moment of conception. You're exposed to different compounds and chemicals as you're developing in the womb, and then you're born, you're exposed to more chemicals now than we've ever had in human civilization. And then you have emotional causes of inflammation, stress, and then obviously physical causes of inflammation if you're not taking care of your body properly. So prolonged chronic inflammation and oxidation of cholesterol is the problem, not cholesterol itself. And again, cholesterol is a required component of the body's innate self-healing mechanism. So the bad is actually not even really cholesterol. It's the oxidation of cholesterol from inflammation and the oxidation of fats through food processing that really leads to inflammation of the arteries and the tissues in general, which contributes to different disease presentations over the course of time. The ugly: cholesterol has been unfairly and unscientifically blamed for heart disease and other health problems. The constant avoidance of cholesterol-rich foods, which is animal foods, and obsession with lowering blood cholesterol numbers has likely led to worse health outcomes in humans. I'm going to show you the research that validates this. And there really is a lot of good evidence that shows that cholesterol itself and cholesterol ingestion of cholesterol-rich foods is contributing to heart disease. Obviously, it's something we always got to be continually studying. So fat and disease, and cholesterol is a fat, it's a lipid that we consume. All studies that have linked fat to disease never differentiated between good fats and bad fats. When we go talk about bad fats, these are the processed fats. I've talked a little bit about these in the past, but they cause cellular congestion, which leads to cellular dysfunction, and therefore can lead to things like cancer and other chronic degenerative diseases, and also inflammation of the arteries, heart attacks and strokes. So cholesterol and fat in and of itself is not a bad thing. Repeat that forever. It's the oxidation of those things from inflammation and from different processing methods by food companies that makes them so damaging. So again, cholesterol is not the villain here. We talk more about cellular congestion. Basically, a healthy cell you see here on the left, when it's healthy, it's communicating properly. It's letting things into this cell that it's needed and getting things out of the cell that are bad. Now, cellular congestion from oxidation of different compounds, fats, cholesterol can congest those cellular membranes and basically gum up the membrane so things can't get in and out of the cell. This leads to morphological changes in the cell. This leads to an inflammatory response in the body. And again, these processes are playing out over the course of life, so it can take time for these disease processes to develop. Some more myths and lies about cholesterol. Cholesterol causes heart disease. Again, the truth there is that it's the oxidation of cholesterol that causes heart disease. What oxidizes cholesterol? I just talked about that. Sugar, bad fats, toxins in our environment, emotional stress, which leads to stressful thoughts lead to different stress hormones being produced in the body, which leads to cytokine production, which is part of the immune response, which leads to inflammation in the body. So literally negative or stressful thinking, dwelling on the past or anxious about the future creates inflammation. And this inflammation, when it's chronic, oxidizes cholesterol and different lipid compounds in our blood, in our body, in our tissues, and leads to basically can lead to different disease presentations, specifically cardiovascular diseases. But does that mean we blame cholesterol? No, it doesn't, because it's the inflammation. Without cholesterol, we'd have an even bigger problem because cholesterol is a very healing molecule in the body. So when you look at the data, more people have heart attacks with normal to low cholesterol. I'll show you this data, rather than elevated cholesterol. Certainly we can be too high, definitely, but you'll see here, especially with the current recommendations, the lower number of total cholesterol, and we'll talk about LDL cholesterol as well, doesn't equate to better health outcomes. So there's a higher death rate with low cholesterol than with high cholesterol. I know that's hard to swallow and hard to believe because they've been telling forever, get it lower, don't eat cholesterol, avoid fat. And it's not having better health outcomes, and it hasn't. And these are statistics from the New England Journal of Medicine. So the myth, cholesterol causes heart disease. And so we talk about statin drugs. So statin drugs are drugs that are used to lower cholesterol levels in the body. There's a lot of different ones over the years, but statin drugs lower cholesterol, but they do not cause a significant decrease in the incidence of heart attack and stroke. So it's these drugs, they do lower cholesterol, but we have to ask ourselves, is lowering cholesterol producing better health outcomes? Again, I'm repeating myself here to drive the point home. It does not. So it's great. Yeah, I mean, it's awesome for the drug companies can show in their research that, hey, look at this drug, it lowered cholesterol. And most people look at that and think, oh, that's awesome, that's going to help us. The reality is it's really not. It's producing worse health outcomes according to the research and the data. So the small decrease that we see when it comes to heart attacks and strokes, and some of the research they looked at is from an anti-inflammatory effect, which again, inflammation is what oxidizes cholesterol and causes the problem, not its effect on lowering cholesterol. So statins cause heart failure due to the depletion of coenzyme Q10. I'm sure a lot of people have heard of that. An increase of over 50%. Coenzyme Q10 is found in things like fish oil. Statins have been linked to liver problems and joint pain. One thing I see with a lot of patients, I would say just about every patient I've seen that's on a statin, they have chronic aches and pains, and they really can't figure out why. A lot of times those patients, it's harder to see improvements with the work I do with structural chiropractic care, because the issue there is from the statin. and the blocking the production of cholesterol, the body's not able to heal from that inflammation. And so you have aches and pains and more profound aches and pains that don't seem to go away. So we look at cholesterol, the molecule here. The image is a little off. I apologize. But so every cell in the body, there's some unique cells in the body that are structured a little differently. But for the most part, every cell has these two, is this part of the membrane of the cell, the outer layer. There's two layers, and they're made up of lipids. And within those layers is cholesterol. So cholesterol, again, is an absolutely essential part of our structure, of our tissue. We cannot survive without it. The human body has developed over the years utilizing cholesterol. So it's also necessary for creating hormones, for making bile acids so we can digest fats, for the proper neurological function of the body. We look at the neural tissue, the nerve cells, and they're covered with what's called a myelin sheath, and a lot of that, the component of that is cholesterol. Cholesterol helps repair and protect cells. It's part of the healing process. Does this sound like something that should be constantly lowered? Not in my opinion, it does not. And again, the research shows that as we lower it, health outcomes are worse. It makes a lot of sense when we look at what cholesterol does in the body and how important it is for healing and for all these different functions of the body. Talk about a little bit more about hormones in a second, but so it's not cholesterol that is the problem. It's the oxidation of cholesterol. We'll keep saying that. Get a little more about cholesterol drugs. This article was a little bit dated back in 2008, but it was about Lipitor. And what they had shown with Lipitor, this one here, Crestor, has not been proven to prevent heart disease, heart attack, or stroke. It had been shown to, again, lower cholesterol in humans. But does that equate to less heart disease, less heart attacks, less strokes? It's not. So we can, claim that it's a miracle drug for lowering cholesterol, but we cannot claim that it's actually lowering cholesterol is producing healthier humans, less heart disease, and just better outcomes. We look at the normal, what's considered normal by, there's a lot of different standards of normal when it comes to healthcare. And this is from Mayo Clinic, Cleveland Clinic, U.S. Department of Health and Human Services, looking at what's defined as normal or high when it comes to cholesterol and triglycerides. So you can see here, we look at total high over 240, LDL high is over 160, triglycerides 200 and above, borderline. You can look at all these for yourself here. I won't list them all off, but in general, these are the guidelines that people have followed. So total cholesterol good is under 200 according to these guidelines, and LDL is less than 100. But we're going to look at some research here and ask ourselves, are we getting better health outcomes when we get lipid levels to what they want? They, as in these sources here, the Mayo Clinic, and I would say just kind of Western medicine in general, these guidelines, as you're going to see, it's not happening. So some research here where they looked at LDL levels in the population and the risk of all-cause mortality. And when they looked at the concentration of LDL-C associated, the lowest risk of all-cause mortality, so of all causes of death, in the overall population, and individuals not receiving lipid-lowering treatment. So that was the lowest risk of all-cause mortality was in people not receiving lipid-lowering treatment. So we're not receiving any drugs or any medications to lower lipids. Okay. These folks had the lowest risk of all-cause mortality. They concluded that in the general population, low levels of LDL and super high levels of LDL were associated with an increased risk of all-cause mortality. The lowest risk of all-cause mortality was found in an LDL concentration of 140. So if we go back, the lowest risk, so the people that were most protected from all-cause mortality had LDL levels of 140. And if we go back and look at what 140 was considered, it's borderline high. So this idea that if we can just get it lower because it's bad, it causes heart disease, is just not showing to be true. Moving on with more research here. This is a graph. They'd done another study looking at populations of people and all-cause mortality. Very similar outcome here. People with that 140 level of LDL had the least all-cause mortality. I apologize, this graph was representing this research here. So basically visualizing here, blood levels with LDL around 140 seem to be most protected. As you got lower, health outcomes were worse. As you got higher, especially as you got super high, health outcomes were also not as good as around that 140. But this illustrates in general that just constantly lowering cholesterol isn't producing better human or healthier humans or better health outcomes. Some more research here done where they looked at these different countries, looked at their average cholesterol levels, and looked at death rates. You look at the country with the lowest death rate, Switzerland, had the highest average cholesterol levels. That would, again, refute this idea that as cholesterol levels go up, death rates would go up as well. Not according to this. Switzerland, which had the highest level of cholesterol, had the lowest death rate. So you have to start asking ourselves, and we've talked a little bit about how important cholesterol is, what it does. Cholesterol is really the precursor to all hormones. And our body can produce cholesterol endogenously. It does so with this compound here. I forget the exact name of it, but that signals to the body to produce cholesterol. And then once we have cholesterol, we produce all these other hormones, these different androgens, endogenous steroids our body creates for the optimal growth, development, and repair of the human body. If you see down here, we also need vitamin A. So obviously there's a lot of different nutrients that factor into the proper function of creating hormones. And that's why I always recommend a well-balanced, whole food, nutrient-dense diet. So you're getting all those different nutrients we need. But in general, the key takeaway with this slide is cholesterol is extremely important for our hormones. And it's very common nowadays in general for people to have mental health disorders and be dealing with depression and anxiety and those types of things. And a lot of times when they're on a statin and they're trying to lower their cholesterol, that's not helping. A lot of times they need more cholesterol so they can produce these healthy hormones that help with growth, development, and emotional health. Some more research here on lipids and all-cause mortality among older adults. Mortality showed a positive association with low total cholesterol and negative association with high total cholesterol and high LDL. So there was more mortality with a lower number of total cholesterol and less mortality with higher total cholesterol and higher LDL. And they adapted the research for confounding variables. And when they did this, the data did not show a higher risk of mortality with high levels of total cholesterol, LDL, and triglycerides. So again, the research is showing that there is not worse health outcomes the higher the total cholesterol, the LDL, and the triglycerides. However, they showed a higher mortality among older adults with low cholesterol. So in combination with the high levels of triglycerides, cholesterol, and LDL not showing an increase in mortality, they did show increase in mortality among adults with low levels of cholesterol. So that's under 100 if we go back to that chart. So the lower they went, the more mortality. We can also look at how cholesterol affects our immune system, which is very pertinent to what's going on in society right now with the virus. We can have a huge profound effect on the integrity of our immune system and optimizing our immune system through what we put in our body, through our food. And you just don't hear this very often in the news. And it's kind of sad because everyone could be empowered right now instead of disempowered through eating foods that help optimize our immune function. So specifically cholesterol, every cell in our body needs cholesterol, including our immune system cells. So substantial evidence indicates that hypocholesterolemia, so that's low levels of cholesterol in apparently healthy individuals, is associated with increased subsequent mortality from cancer and other non-atherosclerotic causes of death. So hypocholesterolemia, which is low cholesterol, associated with higher rates of mortality from cancer and other non-atherosclerotic causes of death. So they're more talking about non-cardiovascular related issues, lower cholesterol, higher amounts of death. Same thing here relative to the high cholesterol group. Low cholesterol men had significantly fewer circulating lymphocytes and fewer T cells. So that's immune cells. Lower cholesterol, less immune cells. These cells, we know specifically T cells play an important role in blocking the threat of a virus, specifically COVID. So again, this is showing it's not better to have lower cholesterol to optimize our immune function. Some more research here. This is with LDL. If we look at the chart here, you can see the incidence here. People hospitalized with coronary artery disease. The vast majority, the higher percentage, had cholesterol levels of basically 100. You can see here 100 to 110, this range, or less. The peak here, this bell curve here, was around 90. So that's kind of the peak of where there's higher incidence of hospitalizations for coronary artery disease. Just showing again, lower cholesterol is not showing to be better, and this specifically with LDL. Dietary cholesterol and lean mass, more research, basically people that consumed the higher amount of cholesterol that was consumed, the more lean mass a person had. Kind of refutes this idea that fat causes fat, eating fat makes you fat or makes you produce fat. It's just not that simple. The lowest level of dietary cholesterol intake had the lowest amount of lean mass, and the highest level of dietary cholesterol intake had the highest amount of lean mass. All right, this is statins and increased COVID-19 related mortality. And this is with patients with type 2 diabetes. Mortality rates were significantly higher in statin users. So statin users obviously tend to have lower cholesterol. Statins work, they lower cholesterol, but it's not producing better health outcomes. Significantly higher mortality rates with statin users in relation to COVID. And routine statin treatment is significantly associated with increased mortality. So increased statin usage, less cholesterol seeping through our tissues, that's showing increased mortality. This specifically with type 2 diabetes patients. Some more research here. Statins stimulate atherosclerosis and heart failure. So literally the thing they're trying to use cholesterol to help with, heart-related, cardiovascular-related diseases and deaths. Statins stimulate atherosclerosis and heart failure. So it's causing what we're trying to prevent it with, or use it to prevent. And they hypothesize that this is due to its depletion of these important nutrients in the body, coenzyme Q10, heme iron, and also blocks the synthesis of vitamin K2, which we know vitamin K2 is needed by our tissues, by our body to help direct calcium into places like our teeth and our bone where it belongs. If we don't have enough vitamin K2, calcium will get deposited into our soft tissues, like our arteries or our cardiovascular tissue. And statins are only upregulating that process by blocking and depleting the synthesis of vitamin K2. Where is vitamin K2 found? It's found in full-fat animal foods, mainly cheeses, raw dairy, and fermented foods. Bacteria can produce it. If you're eating fermented foods like sauerkraut and kimchi, how many people are eating those things? Not a lot, because we've been told to avoid full-fat dairy and full-fat animal foods for years. You think this is all a reason why we have skyrocketing chronic degenerative diseases and heart disease in our country? I have to believe it is. So they even concluded in this research, the epidemic of heart failure and atherosclerosis that plagues the modern world may paradoxically be aggravated by the pervasive usage of lowering cholesterol through statin drugs and also just not eating cholesterol-rich foods. So some more information about saturated fats and health, showing that saturated fat, it's obviously been recommended to avoid saturated fat, but what they showed here, whole fat, dairy, unprocessed meat, dark chocolate, which are saturated fat-rich foods, are not associated with increased risk of coronary or cardiovascular disease. The totality of available evidence does not support further limiting the intake of such foods. So what they're saying is there's no evidence to conclude that saturated fat and the foods that are high in saturated fat are contributing to increased risk of cardiovascular diseases. More research here talking about how diet, the most significant dietary correlate of low cardiovascular disease risk was high total fat and animal protein consumption. Also citrus fruits, high fat dairy, and tree nuts. So these foods were associated with lower cardiovascular disease risk. I know, again, that's hard to kind of swallow because we've been told the opposite for years. The research is just not showing that. So the major correlate of high cardiovascular risk was mainly, they concluded, from eating too much carbohydrates, alcohol, potatoes, and cereal carbohydrates, which are all modern processed foods. Our results do not support the association between cardiovascular disease and saturated fats, which is still contained in official dietary guidelines. Instead, they agree with the data accumulated from recent studies that link cardiovascular disease risk with high glycemic index load of carbohydrate-based foods, so ultra-processed foods in modern human diets. In the absence of any scientific evidence connecting the saturated fats with cardiovascular disease, these findings show that current dietary recommendations regarding cardiovascular diseases should be seriously reconsidered. I agree. And more research here showing, basically just want to show you guys that your diet's extremely important, and you have power to protect yourself from viral diseases, infections, and just chronic degenerative disease in general through your diet. And this is just not really talked about by our best and brightest health organizations. And we can go down the list of all the important nutrients that have a role. Really, it's just, there's so many different nutrients that are found in good, whole, properly prepared foods. And when we get these on a regular basis, ideally starting from a young age, we're going to give our bodies, we're going to optimize the function of our body, of our immune system, and there's not a whole lot out there that's going to bring it down. And that's truly what protects you, is an optimal lifestyle of eating nutrient-dense foods and exercising and movement and trying to have positive emotional health or good emotional health. And they're all interrelated. Once you start eating well, you're going to notice emotionally you're doing better. You're going to notice you have more energy to do physical things like exercise and movement. So they're all interrelated. But you should feel greatly empowered by the fact that you can optimize your health through your diet and through your lifestyle choices. No one's really being told this, again, by our best and brightest health organizations that drive all our public policy. And it's quite frustrating when you see what's going on in the world. So summarize the benefits of vitamins, trace minerals, and nutraceuticals and probiotics in viral infections and blocking viral infections. So that's a lot of info. Hopefully you guys enjoyed it. And if you have any questions or disagreements or anything else at all, I'd love to talk to you and hear from you. So you can email me at drjohnarns@gmail.com or go to our website here, www.completechiroMN.com, for more information. So thank you for listening.